Hello, and welcome to another episode of No Notes, where the conversation is always a perfect 10 out of 10. This podcast is powered by Elios, the most used and most loved AI platform in behavioral health, equipping more than 130 organizations and tens of thousands of providers with powerful automation tools that streamline documentation, simplify compliance, and surface deep care insights that drive better client outcomes. I'm your host, Dr. Denny Morrison, and for today's episode, we are excited to be joined by Dr. Brian Anderson, CEO and co-founder of the Coalition for Health AI, also known as CHAI. We'll chat about the current landscape of healthcare-specific AI standards, why these specialized guidelines are necessary, and how CHAI is working to establish clear criteria for AI solutions. So welcome, Brian, and thank you so much for being here.
Well, Denny, thanks so much for having me. I'm excited for our conversation.
Great. Well, first, tell us a little bit about yourself and how you got to CHAI.
Yeah. So my journey with Chai started about 7 or 8 years ago. I was recruited by a company called MITRE. MITRE is a nonprofit, and they do a lot of work with the U.S. government. And so in that role, I was chief digital health officer. And so I led a number of our strategic efforts in digital health, ranging from working in the oncology space to developing standards. And then in the pandemic, I was asked by the Trump and then the Biden administration to help lead data analytic efforts as part of Operation Warp Speed. And so in that setting, you had a bunch of private sector organizations working alongside the federal government, all of us focused on trying to solve the pandemic. And it was in that setting that, one, I think we appreciated the impact that a lot of organizations we could have if we weren't working competitively, if we were focused on, a common effort. And so we asked, there's something more that we can be doing beyond the pandemic. We looked at AI, and I still remember this, the initial conversation we had in March of 2021 was, do we have consensus agreement at a technically specific level? So a level that would inform a software developer at a technology company, or that would inform an implementation or a deployment of an AI model at a customer, like a health system or a payer. And the answer we quickly came to is, we have general agreement at a 50,000-foot level about the principles of responsible AI. Like, we all want fairness, we all want transparency and robustness and accountability and privacy. But at that technically specific level, about what that actually means, we don't have consensus. We have a lot of really good work being done at a variety of different organizations, but not consensus. We want a common definition about what good looks like, about what good responsible AI looks like. And so I think we agreed that this is something worthy for our organizations to work together on. And so that was really the start of Chai, is building consensus at a detailed, specific level for the private sector community. It was led by private sector organizations. I think one of the really wonderful things about Chai is we quickly began engaging the public sector. I mean, in a space like AI where things are moving so quickly and it's so consequential, you want the private sector innovators sharing amongst each other about what these best practices look like, to come up with common definitions about what good responsible AI looks like. But you also want the public sector officials understanding where the private sector is moving, new use cases like behavioral health that come up, so that the policymakers and the regulators are informed, so that they're not making, uninformed, ham-handed kind of regulations that are going to stifle innovation. And so that's been, I think, one of the really exciting things about Chai, is you have public sector and private sector working together. And that's the way it started. We started with 8 organizations. We now have over 3,000. I think we're the largest health AI coalition on the planet. And we continue to have public sector and private sector engagement. So I'm really excited and proud of all of what our community has done.
So that is amazing. So what is Chai's role in this whole schema that you just described, and and who funds Chai?
So Chai is all about bringing together organizations and facilitating the best practice conversations that we're having in these working groups. The atomic unit of Chai is these working groups. We have about a dozen of them that all of our community members have the opportunity to join. They range in size from small working groups, maybe about 10, to very big working groups, upwards of 30, 40, 50 people, each organization having a seat at the table, building these consensus documents. That work is being done by my team, helping to facilitate, helping to do the technical writing. Once you have a common definition about what good responsible AI looks like, you can then enable the independent evaluation and validation, as well as training of those models with that North Star definition of what good responsible AI looks like. And so the work of Chai is really both developing the best practice frameworks and also supporting this ecosystem of what we call quality assurance resource providers that essentially have this high quality data. And there's a whole network of about 30 of them that facilitate model training and model validation and model testing. Now, the funding of Chai, it's complex, but for the most part, it's funded by our members, funded by the community.
Very cool. So I don't know about you, but it seems to me that I know you've been in this for a little while now, but it has just taken off. I mean, it seems like every day it's something new in healthcare AI, and I'm wondering where do we stand with kind of standards in this industry? I mean, it seems like you guys has been working on this for a while, but it has really evolved pretty quickly. So what's the current state of the art?
Yeah, I mean, part of the challenge is things are moving so quickly that new use cases are coming up all the time, right? Emerging capabilities, models are becoming more robust, more powerful, more able to do things like reasoning and multi-step reasoning, chain of thought reasoning, that opens the door for different kinds of use cases. And so in each of these use cases, I think what we found in Chai is if you want to have technically specific and detailed best practices, you need to focus at the use case level. And so what we've quickly begun doing in Chai is building out these best practices, but focusing on a use case by use case level, because that's really where you get down into the details to help inform, be it for clinical trials or prior auth or clinical decision support, and traditional AI versus generative AI. Each one of those has very different ways of thinking about the appropriate responsible development, deployment of AI. And so, if you ask me kind of where are we in the development of the standard space, I'd say, we're very much at the beginning of this. And in Chai, we've only been at this for, informally since March of 21, but, we launched a nonprofit last year formally because the organization got so big, we couldn't, staff all these working groups with just volunteers. And so we really needed to have a little bit more intentionality and process and structure and resources that we could bring to bear. So we're just getting started. My hope is that as we build out this kind of framework across use cases, we're going to develop, you know, an ability to take certain things that we're learning in use cases and apply them to others. So it's not reinventing the wheel each time with each use case.
Where does Chai come down on topics related to confidentiality and um, uh, patient disclosure and use of AI in healthcare and consent forms, for example? There's some argument about whether consent is required when and if you don't record anything, but you're using an AI. Some say you don't need that. Some say you do. So that's kind of it seems to me that's where the transparency and trust start at that point of contact with an end user patient who is you're going to use AI. What what do you guys think that should be done about that?
So great question. AI is a tool. And like any tool, if I'm a doctor and I'm going to be taking care of my patient and the tools that I'm using in a procedure are really important to that procedure, every doctor you ask will tell you, yeah, you need to get informed consent from your patient. Now, in the AI space, it's it's not black and white in that like every AI model that touches a patient, should I go through a really robust, detailed 10 to 15-minute conversation with my patients? Maybe not, particularly if it's an AI model that's maybe helping with scheduling or maybe helping with back office administrative workflows. I would say personally, um, as a minimum level of transparency, patients should know as a disclosure at a minimum if AI is involved in their clinical care. I would think that'd be helpful. Whether or not it goes to the level and rises to the level of informed consent, I think that's where you really need to understand the details and the consequentiality of the use of the AI tool and whatever that specific use case is. But it's an active area of conversation. I think the other important part about this is, okay, say I've given informed consent or I've given a disclosure. One of the important parts you brought up, which is privacy, like are the data that's collected or used as part of the clinical care for me going to be used to train this model? Is it going to be de-identified or is it going to be identifiable data? And I think these are really sensitive and profoundly important conversations that we as doctors or as technology companies need to have with the consumers and patients that we're working with. Individuals need to be really aware and really careful in who they share their data with in this AI world, right? There's great promise and great excitement and potential in having that data have a real meaningful impact on your life. I can list multiple examples for you. Close friends of mine who are alive today because they shared their complex cancer case with an AI agent because their doctor didn't know the diagnosis, but the AI agent discovered it. But the risk in doing that is how do you keep your data private and secure? And so you need to be very careful and very thoughtful in who you share your data with because the safeguards, we don't yet have the policies and regulations in place because the space is moving so quickly.
But it's an interesting use case that you mentioned that about how if I choose to take my data and do something with it, at that point, it's no longer protected, at least the way things are today. But and that is really an interesting challenge for the industry. Do you have any feel for what direction that's going to go? I mean, for example, will the HIPAA requirements follow the data to the vendor, let's say, or the health AI, or will the health AI have to recognize HIPAA? Or got any crystal ball for us, Brian?
I think it's a great question. You know, at a policy and regulatory level, I would say there are two lanes to this. One is at the federal level, and one is at the state level. Um, I think given the current realities of the political environment at the federal level, I got to believe that it's going to be harder to get consensus at the federal level on something as big as patient data privacy and protection as it relates to third-party actors currently not covered by HIPAA. Now, at the state level, we're talking to multiple states, about 20 or so right now, that are contemplating how to do this. And are there state level protections as it relates to patient data that vendors, right, currently non HIPAA covered entities would need to abide by? Um, and those are such early conversations that, I'd hesitate to kind of peer too much further into the crystal ball on this, Denny. But I do think that some states are exploring and have appetite. And, I think it's probably appropriate appetite on protecting patients' sensitive data. I'll give you a great example. Genomic data is now becoming more readily accessible. Your personal genomic data. Some would argue, can genomic data ever really be de-identified? Right? Because that is such a unique fingerprint to you and I. And yet it's so important when we think about, targeted therapeutic development or, different drugs and how they interact with our bodies, or predispositions to certain kinds of diseases. Um, how do we share that data in a way that helps us live healthier lives but also protects our identity? These are questions I don't have answers to, but I know that many regulators are struggling with. I hope that individuals develop the kind of AI literacy that we need to be able to use these tools safely and effectively, just like any tool. And so that's a massive undertaking to make sure that everyone that is going to potentially touch an AI model is educated on some of the risks associated with it. But I think this is a really urgent need for all of us, literally all of us, to understand the benefits and the harms of AI. It's like the invention of electricity, if you're asking me, right? Like this is something that's going to profoundly affect every one of our lives. It may not be immediately, but it's gonna affect all of us. I think there's been a lot of research and a lot of documentation that many people struggle with loneliness, particularly for men, for young men and older men to develop meaningful friendships with people. And on top of that, you have an environment where there are so few mental health professionals. The access to getting a visit with a psychiatrist or a psychologist can oftentimes take, multiple months, if not, maybe even half a year. And one of the things that excites me the most about AI is its ability to meet people where they are and provide the kind of access that we really need if we want to live healthier, more complete lives. The challenge is, how do we ensure that those patients are able to share their most sensitive and private parts of themselves with a model, with an AI model that is going to keep that data private? Building that kind of trust is going to take time, but I think it's something that we really need to do if we want to use these models in these really sensitive, profoundly important use cases like behavioral health.
Well, I love your analogy with genomics because I think that's a really good kind of stalking horse for kind of where we are these days. I would argue, though, that we're kind of in the same position, though, with data. And some of the research I've read is that even with today's computing technology, that with as few as 3 data points, you can pretty much identify individuals in a de-identified data set. So, and actually, one quote that I use when I present on this is that the usual expectations of privacy and healthcare data can no longer be met. So we have this. I think part of it is just like in any situation. If somebody really wants to crash your system and get your data, they probably can. You just make it so hard that it's not worth it to do that. But these days, I think one of the things that people also have to understand is that there is a limit to how much privacy is literally functionally possible. I mean, even government systems with all the security systems in the world get hacked, and so I think a lot of people like to believe there is a way to make it perfectly private and secure, and that's probably not a realistic expectation. But you're
I mean, I
but
think one of so agreed. I think there's a lot of different technical approaches that are being explored. One of the areas that I think I've gotten really excited about is an approach called confidential compute, and it's a federated approach for learning. So essentially, you have the data never leaves the secure environment where it's at. And the data, I think to your point, you still need to de-identify certain parts of it, right? This is a very hopeful approach that we're exploring in China, that many of our organizations are exploring, um, is how do we make that kind of data accessible to accelerate learning while also protecting patients' privacy?
that's an exciting opportunity, I think, because I think and I think this really speaks to why Chai exists from my perspective. When I think of what you just said, like that, figuring out a way to solve that problem is like no single vendor, no single government entity could do that. But I think a federated group approach targeting this thing is really a good solution. And I appreciated what you said a minute ago about the paucity of providers in the behavioral health side. In 15 years, we're looking at a deficit of 500,000 providers, and it's already hard to get in. So I know some people who listen to this might be kind of taken aback by the idea of an AI actually serving in a quasi therapist role. But we've been doing this since the 1960s when Joe Weizenbaum at MIT built ELIZA, which was the first chatbot. Now, you know what computing was like in the 1960s. And he still had people building personal relationships with this really crappy product. What the data shows for recently is that people who use more sophisticated chatbots are oftentimes more honest with them than they are with therapists because there's no judgment.
Agreed. So, I mean, like, so much to say about that, Denny. Thank you for bringing that up. Multiple examples in Chai of what you just said, of an individual that finds themselves more trusting, more open when they know that they're engaged with an AI therapist because there is no judgment, right? Because even as a therapist, as the most trusting psychiatrist, as a patient, you're naturally going to think, oh gosh, what is that? What is this doctor
He's
thinking
still
about
a
me?
person. He's a person.
Yeah.
People are judgmental.
And so, there's a company called Healthvana, and they rolled out an AI chatbot. And this AI chatbot is working in the, very vulnerable communities of, individuals struggling to navigate, do I have HIV or not? And engaging in that space with an AI chatbot talking about your sexual practices, your sexuality, your identity, those are really sensitive things.
Yep. Yep.
And what the researchers at this company found is when they made it very clear that this was an AI chatbot and that, this AI chatbot was not judgmental, those individuals shared so much more. The other thing is we find in a growing body of research that these AI therapists, that these AI models are more empathetic, or at least the experience by the end
Yep.
user, by the
They're
by the
perceived
the
as more
patient,
empathetic. Right.
perceived as more empathetic. That's right,
Yep. Yep.
perceived. And I think that's really important because, as a physician, your time is pressured. You only have so much time. But as an AI agent, you have all the time in the world.
Yep.
And you can be endlessly empathetic and patient. Candidly, I was really excited when President Trump announced his executive order on AI, and he announced three main policies. The first was national security, the second was economic competitiveness, and the third was human flourishing. And I was excited about that third one because, it speaks to this challenge that we have in AI called the alignment problem. How do you build AI models so that they understand an individual's value structure, right? Your values are different than mine, right? And if I'm going to build a model that's going to need to be able to advocate for you, to challenge you, to push you maybe in good ways to grow, or to help you navigate a complex medical decision making where it's really important that I know what your values are, particularly it's like end of life care. How do you build those models so that they can take in those values, your values? So the model's going to need to advocate or do things subtly differently. Solving that alignment problem is going to be a real challenge. We haven't solved it yet. It's a real challenge in the AI world to build models that are built in a way that are aligned to your values, to our values.
We have the same thing with physical therapists, with human therapists, in that we one of the 30% of the variance in clinical outcomes in psychotherapy can only be attributed to the therapeutic alliance between the client and the therapist. And and we also know that when that alignment does not occur, you can't fix it. You have to change therapists. That's
Yep.
akin to that alignment problem on a human scale. So I'm not surprised that that's a challenge. I mean, getting an AI to understand the nuances. Heck, it's fascinating to me here at Elios that we can do the nuances of psychotherapy analysis now. I mean but to get to that point, it is going to be a challenge. And yeah, I'm glad to hear that you guys are working on it and trying to figure it out. Who works on that on your end? I mean, on who is that one of the work groups? Is behavioral health a work group, or how did that work?
Well, it's we call it actually the Human Flourishing Project, not to sound too grandiose. So yeah, I mean, it was an effort we just launched, and it includes a really large, diverse group of stakeholders. We have technology companies, we have, health systems, we have payers, we have ethicists, we have patient community advocates, and that's sort of kind of the recipe for the vast majority of our working groups. The Human Flourishing Project is different though because it gets to this very challenging level of alignment. And when you think about human values, like how do you code human values into the weights of a model? We don't know how to do that yet. And so this working group in particular, it still has the technologists, it still has the health systems, the doctors and nurses, but we also include a large number of ethicists, and we include faith-based leaders. And community leaders. And so those are the kinds of stakeholders that we're also including in this. It absolutely, I think, is going to find resonance with behavioral health technology companies like Elios, right? Because speaking to a therapist, you oftentimes talk about those parts of your life that, aren't the kind of, am I physically well or physically not well? It's more about like, how are you feeling at a level that it relates to relationally? I'm really excited about the group because it, I think, forces Chai to think about health in a much more holistic way, beyond kind of, I'm wearing my doctor hat and I'm going to give you a diagnosis for, hypertension or something.
This is kind of a almost a metaphysical de-siloing that mirrors kind of what we're doing with data transfer. It's like when you think about it, we're really kind of deconstructing the silos where we have, okay, here's the body, here's the head, here's the parts of the body. I deal with the left kidney, and that's what I do. As opposed to
Yeah, yeah, yeah.
this whole person perspective. But values are tough, man. Like, they just are. They're, it's hard to put your finger on what one is, and I know it when I see it, but that's hard to code.
Yep, it is, it is, and it's gonna be yeah, I mean, I'll be honest with you, I don't know if we're gonna succeed at it. I think
Yeah,
I mean,
yeah.
it's been a challenge to your point, AI has been around since the '60s, '70s, and this has been a known issue since then. Are we gonna make progress on the issue? I certainly hope so. Are we gonna develop greater transparency about how these models successfully or unsuccessfully can navigate the value alignment issue that leads to human flourishing? I hope so. I hope we'll have greater transparency, at least around that. I mean, when we take a step back and look at human history and look at the invention of different kinds of tools or different inventions, the most profoundly impactful ones have been those that have led to human flourishing. And, we think about, what that means. And there's a whole, slew of examples from like the one I like to look at is the sewing machine, right? Sewing machine was invented in the 1860s. And for, the vast majority of the 17, 1800s, sewing was done is like a cottage industry. And the people oftentimes doing it were women, stuck at home or stuck in a shop. And all their time was consumed doing it. Sewing machine allowed that to certainly be done at an industrial scale more efficiently. But one of the more important things that occurred because of that is it freed up time for women to be more active in society, to take a more active role. It led to, I would assert, to women's suffrage, which happened a few decades after that, right? Women's voice in society and politics became much louder and much more heard because they had more time, because this tool, the sewing machine, allowed for that. My hope is that AI as a tool will allow for that same kind of human flourishing. And my hope is specifically as it relates to behavioral health, that it will allow all of us to lead, I think, much more introspective, much more reflective lives, much healthier, emotionally healthier lives, more connected lives with the people that we love and the people that we care for.
And these disruptive innovations often take us in places where we hadn't expected. I mean, who would have expected women's suffrage to be a byproduct of a sewing machine? We're getting kind of close to time here, so I want to talk about the future and in terms of where you think this is going to go, and at the micro level, kind of where we're going relative to kind of the adoption of AI solutions and what our listeners should be looking for and expecting for behavioral health AI or behavioral health organizations for AI solutions. But in a macro scale, I got a big question I want to lay on you. What do you think is going to happen when we get to quantum computing and AI? So,
So on the first question, I had said at the beginning, we're focused on a use case level. I don't see that changing. The only way we're going to eat this, 800-pound elephant is one use case at a time. And so we're really focused on trying to launch and move out as many use cases as we can that will help kind of fill out the picture of what responsible AI looks like across health in general. I think we're really excited about the network of quality assurance resource providers. I think the other really exciting thing is this nationwide launch of a registry that we're focused on in Chai. I'd said at the beginning, partly how you're going to build trust is by seeing transparently how these models perform. And the way that I think you do that is you go to the places where these models are deployed. And we're obviously looking first at health systems and health payers and health plans. And so we have over about 50 different organizations now that are committed to sharing how those models are performing with a common set of metrics locally in their environments, sharing that with the public. So imagine a future very soon where you and I can go to a national, a nationwide registry that's publicly available and we can see how models are performing from site to site. I think that scares some people. I think likely scare some vendors where you might have variance in how the model performs from one site to the next. And that begs the question, why? But that's the kind of transparency that we need to solve some of these, concerning variances in how models are performing across different regions, across different populations of people. So at a micro level, I'm excited about that kind of transparency with the registry. I'm excited about building trust with these quality assurance resource providers. Quantum computing, I think, is a really fascinating space. Quantum computing is going to take time. When we have quantum computing and AI at scale, will certainly be in an era that many of us call superintelligence. I think when we're in that space, quantum AI and superintelligence, it's going to, one, be, I think, a profoundly disrupting space. And I think that's going to be scary for a lot of people. I think that's a reality that we need to come to grips with. And what do I mean by that? I mean, that means our public sector officials need to help society through that because it's going to be disruptive. People are going to lose jobs, but new jobs are going to be created. So, how do we upskill people and prepare them for that kind of disruption? There's also potential for great harm, right? These models could hurt people, they could give bad advice. So, how do we build the right kinds of guardrails and transparency and oversight so those models keep us safe? If we haven't solved the alignment problem, not to sound too alarming, but there are real concerns at an existential level that we should be focused on.
Yep.
So
Yep.
I'll leave you with that, Denny.
Yep. Yeah. Well, Ray Kurzweil and Stephen Hawking agree with you that both of them were concerned about what's going to happen, the singularity, and after that. But let's get our uh, responsible AI taken care of now. That's tomorrow's problem, not a small one, but like you said, those qubits are going to wait. So this has been absolutely fascinating, Brian. I wanted to thank you for joining us today. We're going to be signing off now, but I hope maybe we can have you back again and continue this conversation. This has been a really fun conversation today. So,
Likewise, it's been fun, Denny. Thanks for
Brian,
having
thank
me.
you very much.